Welcome to the Pet Care Report podcast by Pet Summits. Here's your natural dog healthcare host, Alora McKinley.
Well, g'day guys. Welcome back to another episode of the Pet Care Report. Today we're going to be talking about something that has been used for centuries, that has been really well researched in humans and in dogs, but it's still not greatly understood or utilized to its fullest potential. Now, what do you think that could be? Well, today we're going to be talking to Dr. Susan Bora. She's a holistic small animal veterinarian from California. She's trained and passionate about traditional Chinese acupuncture, herb and food therapy, witnessing the transformative effects of whole food meals on her patients. Dr. Bora founded Chi Dog, delivering fresh, balanced, cooked meals for dogs across the US. Now, Dr. Susan believes in an integrative approach to canine nutrition, living by the principle that food is the first medicine. Thank you so much, Dr. Susan. It's great to have you on today.
Absolutely. Thank you for having me, Laura. Great to be here.
And today we're going to be talking about food therapy. Now, can you explain the fundamental principles of food therapy?
Yes, food therapy is a discipline in traditional Chinese holistic medicine you're right, it's been used for centuries. And it's the idea that food has an effect on the body the same way herbs do, the same way we see acupuncture affecting the body. It's used in that same way and sort of an extension of herbal therapy to see food as kind of the food that the medicine that we take in every day, right? So it's trying to use that food more intentionally. So we understand that certain foods warm the body, certain foods naturally cool the body, certain foods naturally moisten the body or help to drain toxins. So it's the concept and the discipline of using food and what we eat to try to help benefit our body, the same way that we'll use herbs or we'll use acupuncture. So it's really been something that I've been really amazed at the transformations that I was seeing in my patients when we really started to use food intentionally.
Yeah, and now we can use food therapy to treat a whole heap of conditions that we also use conventional therapies for as well, such as GI conditions, skin allergies, and other conditions. Can you go on about that?
Yeah, I really wanted to. GI kind of makes sense to us to think that what we should affect our GI, right? That's kind of an obvious. The idea of skin is something, and how our food affects the health of our skin, and for dogs and cats, the health of their coat, is something that we, as Western practitioners, haven't really connected. We're just now beginning to understand the importance of like the GI microbiome and how that does affect your skin and coat, which is nice from a traditional Chinese medicine perspective, because it's kind of a connection that Western medicine is starting to make, whereas holistic traditional Chinese medicine has always said that if you want to know the health of an animal or a person's nutrition, you look at their skin, or in dogs and cats' case, their coat. That's really, we have a saying that if you want beautiful skin, you need beautiful blood. And that means nutrition. So we really look at the quality of our nutrition as important in both the skin and the coat, as well as sort of the more obvious things like your GI tract and chronic inflammatory conditions that we sort of are well studied in human medicine, that we understand that the quality of the food, and specifically using, and for dogs and cats, there's a lot of the majority of their food is processed, right? It's processed kibble, it's processed canned food, and processed food puts heat into the body. High carbohydrate diets put heat into the body, or we'll say it in Western medicine, we'll call it pro-inflammatory, right? So it's kind of the same concept. It's the idea that if you eat Chinese medicine, we say hot and dry food or processed food, you end up hot and dry or have lots of inflammation. So intentionally using food that is clean meaning real food. So cooked whole food, like actual, food ingredients that are quality. Like we would say, we call it, human grade or food that humans can eat. Using that as the basis of ingredients is very important. And it's kind of the premise of, if you're going to look for a healthy GI, to decrease chronic inflammation in the body, for healthy skin and coat, you have to start with quality ingredients. You can't supplement your way out of, poor quality, high processed food. And that includes, prescription foods, to be honest. They're all processed.
Now, with food therapy, are we talking about like a particular ingredient, or are we looking at a recipe as a whole? Like, how does that?
You can do both. I mean, as far as for a specific ingredient, we do think there are, especially for dogs, right? For dogs and for cats, they're a little, I don't want to say limited, but they're specific in the types of food they want to eat. So we could say, well, dandelion greens and radishes are great for that problem. But we have to decide what would this species, what's also species appropriate for this animal to eat, So for people, we may want to have a salad, but for the dogs and cats, it's not quite what they, so to get the same effect, you think of what specific food. So for example, in our Chi-Dog diets, we thought, okay, well, the turkey as a whole food is naturally cooling to the body. So a lot of our chronic inflammation conditions, we benefit with turkey just as a single ingredient. Whereas our, we can also use pork. Pork is a neutral ingredient. But the nice thing from a Western medicine perspective is pork is often used for conditions of inflammatory bowel disease, food allergies, whenever we're worried about an allergy, because pork is usually novel protein for most animals here in the US and for other parts of the world as well. Just it's a common protein. It's a protein that they have not commonly seen before. So we use that as a whole food ingredient, albeit it's neutral. So you can build cooling ingredients to go with it. For example, we use the cooling ingredient barley to go with our pork diet so that we can kind of couple that and make it a little more anti-inflammatory. So we get the benefit of the novel protein, which is what Western medicine wants. And then also, a cooling diet so we can get anti-inflammatory to benefit for a lot of these chronic inflamed GI conditions, a lot of these chronic skin conditions. So you can kind of build it either as a single food, like I know this single food is good, or, even better would be build a full recipe around it. How can I really get, for example, we use a lot of beef when we want a real hydrating diet, and that can be for diabetics, for chronic dry cough. Those chronic, even like dandruff, like anything that's internal dryness, we'll think, how can I build a recipe around this food that's great for dogs and cats to eat, that's species appropriate, that can also be beneficial for their body from a food therapy perspective, and that they will like to eat. That's kind of, we need to have that component in there.
And is there any limitations to food therapy? Can it be applied to every single dog or?
Well, yeah. I mean, we try to, and that is the goal, right? That's the limitations just and specifically for dogs and for cats. Cats, more so than dogs, we worry about palatability. Do they like it? Because, we can kind of say there can, any person who's had a cat who could be they tend to be more finicky. That is by their nature. Right? They're similar to horses in the sense that they can be more finicky, and that's normal. That's part of their nature. The other thing that we see is with dogs is that sometimes they'll have, and cats too, but I clinically in practice see it a lot with dogs, that they'll have problems with, specific allergies or concerns of allergies. Sometimes we don't know 100% if this dog is allergic to X ingredient, but we have a reason to be concerned about it. So we're probably not going to build that into a recipe. So we think about palatability, we think about allergy. Those are kind of the biggest limitation. And of course, species, right? We're not going to feed a dog a kale salad, for dinner, maybe great for us, but for our species, we have high meat, low carbohydrate. That's one of the tenets in food therapy, related to species that we try to, I guess I'm going to be honest, that we try to correct with that. We think the Western medicine diets can tend to be very high carbohydrate sometimes. So we really try to get a diet that's not quite so high in carb. It's kind of one of the principles.
And you mentioned that you use this in your practice quite a bit. Is there any examples that you could tell us about how food therapy has really changed a dog?
Oh God. Yeah. There's so many that I would say routinely, I really should have taken a before and after picture, but I never want to jinx myself on the before picture. So I never do it. But then when they come back and they're improved, you're like, oh, I really, yeah, sometimes I've had to use food therapy as the sole treatment when we don't have a lot of other options. And that's kind of when it's really been, when I've really seen a dramatic improvement. For example, I had a dog who had gone to many doctors trying to get a fairly rare viral growth in the mouth that was fairly uncommon in our area in Southern California. And they'd gone to just tried therapy after therapy, Western, Eastern, mostly Western. They'd kind of gone through the gamut of all the pharmaceuticals. And this dog was not one that I could do acupuncture on because it wasn't amenable to that. Didn't really want you getting that close to it. And we also had some limitations with some of that because it was an oral problem. So the client honestly had problems putting things in the mouth for this dog. So the only thing we have was food. So we just said, okay, we're going to do, and this is before we formulated our diets, we did a lot of home cooking. So I said, okay, let's try a home cooking diet. That's all we got. This is going to be a food therapy case. And so that was the only change we were able to make. And that dog, recovered in months. Resolved, so things like that kind of go, it's the eye openers, but then more consistently on a daily basis, what I really try to focus on is especially when we have a dog who's got a problem with their food, because that's a problem that owner and that dog deals with every day. right? It's not something that you can just come in next week. If they're not eating, that's a problem this morning. That's a problem tonight, So we really focus on what I've seen consistently is when we allow that dog who's not eating, or maybe they're eating and they're having GI upset, or maybe they're not gaining weight, or they're getting too much weight, anything that has to do with sort of obvious with food. Those are the dogs that we always start with food therapy. I mean, we've got it, especially if they're on a processed kibble diet, whether it's prescription, even if it's, quote unquote, the really high end or expensive, because they've got a lot of marketing behind them, those type of diets, we got to get them off the kibble, right? We got to get them on real food. And so that we're doing routinely on a daily basis. So a lot of our pancreatitis dogs, I've seen incredible improvements. Inflammatory bowel disease dogs, even like liver enzyme dogs where their liver enzymes are elevated. And so we're focused on the liver as an organ. If we couple that with I think it was an anti-inflammatory diet, which would be a cooling diet, right? So we'd try to do like a turkey-based diet or a pork-based diet if we're coupling it with some other cooling ingredients along with that. Even a beef-based diet that we're coupling with some cooling ingredients, then we can really see some improvements. But I think the biggest take home is allowing our dogs to eat food, good quality food, can be a major change in their health, right? Both preventative medicine as well as turning around chronic inflammation. And that's what I see on a daily basis in practice.
Yeah. And I think it can be particularly hard for pet parents because a lot of vets are hesitant about a fresh food diet. So from a perspective, how can they approach this?
Well, it's not nice, but the obvious is when your dog is having a problem, right? Because it is scary, right? And we are all very, just like we're all very attached to our food. It can be very personal, it has a lot of history, especially if it's, this diet worked for so many years and now it's not working. I see that a lot with raw food diets and we explain that with holistic medicine and Chinese medicine. We say raw food is great when you're very strong and healthy. So that dog has got, plenty of chi, right? Because they're cooking that diet. They eat the raw food. They feel good. They're cooking it in their body using their own chi. And then they're using that for energy. When they start to get a little bit imbalanced, and that can be just aging, that could be a dog who's, littermate does great on raw food, but they don't, their chi is not quite as strong. Those dogs need to be switched off. So that can be an example of, the diet did well for a long time and now it's not. And so it's hard to move and it's unnerving, but the biggest change is when the dog's not doing well. I'd love to see them when they're puppies. And I love that because then we can think, awesome, let's not put a bunch of inflammation into your body with food. Let's keep you with a clean diet. But as far as transitioning, I would say if your dog's not enjoying their food, not benefiting from their food, having chronic GI problems or skin problems, you need to try something different. And that's usually when we try to go to a whole food. And that can be really, really rewarding when you're able to give them something that they love in their bowl. I mean, sometimes it's just as basic as that, that they actually, eat it well, feel good, and you can see some benefit. And you do. I mean, I'll tell clients as far as when to see changes or how to see changes, skin and coat, and it's sort of the subjective things like, how does my dog feel? How are they moving? Do they seem more energetic? Those are very subjective. But those changes I routinely see in, a matter of a week or two, just like us. I'm sure Laura, you eat something good for lunch, you feel good, right? If we eat something that we know we shouldn't, if we French fries and cake, it wouldn't feel so good that afternoon. It does take it doesn't take long.
Yeah. And do you find that food therapy, sometimes you can wean your patients off traditional Western medicine? Does it ever take?
Oh yeah, I would say, yeah, that's always the goal, right? We always want to get them balanced enough to where we can sort of we want to age gently, right? We're all going to age in a balanced way. And that's the trick, right? I would say there are some conditions, and when I say some conditions, the goal for things like pancreatitis, things like inflammatory bowel disease, a lot of our chronic, inflammatory conditions, we can often get them off of, but it depends on the dog. Depends on how imbalanced they are, other complications. Usually I start with the goal of, let's make this patient better, right? So it's not, we're never saying, let's take all the pharmaceuticals and, we don't need those or none of that. It's always, let's add with food therapy, especially if we're not starting with a clean real food diet. If the dog's already on that, the nice thing is I'm always thinking, great, I can bring more to this, right? You got your pharmaceuticals, you've got your very important herbs and your acupuncture, and those are all really important pieces of health. But man, if we're not starting with a clean diet underneath to be the foundation, it's just, it's just not going to be it's going to be a lot more difficult. So if I can get them on a real food and particularly a food based on food therapy. So we're going to use specific, for example, chicken is a great, gentle meat, right? For most dogs and cats, we call it a chi tonic. It's very gentle to the body, but it can be a little warming. So if we have a dog who's got a lot of inflammation, we probably wouldn't pick that. If we could pick a turkey, which is also lean, like chicken, we might start with that. So so if we can kind of be intentional with the food, and get them on a diet that benefits their chronic condition. And I have on our website, we have all kinds of lists of different conditions and the different, whole food ingredients that we use. That can be a starting place that we really try to get them to see that improvement. And ideally, if it's a condition that we can get them off pharmaceuticals, that's the goal. I shouldn't say it's the goal. That would be an added benefit. The goal is a dog who feels good, right? Or a cat who feels healthy. That's the goal. Is
food therapy the kind of thing where a pet parent can do half kibble and half a fresh food diet?
Yeah. I mean, it's just like us. I could eat French fries and that's all for lunch, or I could do half French fries and half a salad, right? And that would probably be a better choice, right? So it's not like you can have to do an all or nothing. And some dogs, I'm sure, you've talked to a lot of pet parents who have dogs who are very sensitive, right? Very sensitive GI, and lots of history of issues, a microbiome that we know is really out of whack. And that one you might go baby steps, right? So we're not going to, and we're definitely not going to do the, back when I was in school, there was a lot of that. Well, the dog will eventually eat. You know what I mean? That kind of tough love approach. Eventually, we'll just put it down, and one day those kinds of things. We never, we gentle, right? This dog does want to eat. They do want to feel good in their stomach. They do want to be healthy. So even if we have to do a half kibble, half whole food, that is so much better than all kibble. You're at least getting some of that real food nutrition, and you'll see it. Mostly because you're going to see improvements in what Western medicine we think of like hydration. You know what I mean? We'll see that people will talk about, my dog doesn't drink so much water now that they're on a real food diet, or even half and half. That's because they're getting more hydration from their whole food, So you'll see some changes even if you're doing half kibble and half home cooked. That's still such an improvement. The dog will, and just as a pet parent, I'm sure I mean, how happy would the dog be to get some real food, because they're going to get real nutrition out of that.
Yeah. And is food therapy the thing that is only used as a treatment? Can we use it as a preventative as well?
Yeah, that's a really good question. We use it all day long as a preventative. And the beautiful thing is when I started practicing, and we would see these perfectly balanced, perfectly healthy dogs, puppies and kittens, and their coat is gorgeous and their eyes are bright and their muscle is, and they just look, they're just perfect, right? We always thought, okay, it'd be great to have that animal stay that perfect. And then when I would see them when they're 5 and they're 10 years old, and their skin is bad and their coat is dull and they're kind of pot bellied and they're tired. I honestly just thought that was aging. I didn't identify that was a lot of impact of food and chronic inflammation from a pro-inflammatory diet of processed food, until I started doing food therapy. And then I start to see these puppies as they grow look better. I mean, just frankly, look better, feel better when they're 5, 6, 10 years old. And I started to realize that this is really the change in what we can see from a food perspective. So think about how to use it as a preventative. You can we do have in traditional Chinese medicine specific constitutions, and that we identify. And usually those are kind of similar to breed. Like all our little, not all, but most of our little Yorkies and Chihuahuas tend to be fire personalities, and our giant breeds tend to be water. So then if you want to get really specific, especially if you have a pet parent who has a holistic, trained or Chinese medicine trained veterinarian, they can identify this is the perfect type of constitution and diet for your healthy puppy. But in general, overall, just keep them off processed kibble and on real food, and you will get that preventative, that we're all looking for, to keep them perfect when they're, when we got them.
And I love that you mentioned puppies, because a lot of people think that, my dog has to be raised on kibble because it says it's a puppy kibble and it's, it's made just for them. Is there an age that you can start, or can you start?
Yeah, weaning. A lot of times but it has to be balanced, right? That's the big, right? It has to be balanced. So we all love home cooking, but it has to be balanced. And balance can be, I don't want to say it's not, it can be complicated if you have no, if you don't have a veterinarian to support you. So I would say always get a, holistically trained veterinarian or veterinarian who's trained in clinical nutrition who can at least help with balance of a diet. The alternative, the sort of the shortcut way is to take like a pre-prepared, real food diet that's cooked and shipped, like the Chiog or the other diets. But whenever we have, but there are some of those diets are balanced for puppies and some of them are not. Ours is, and the thing that you want to look for is something called, in the US, they call it, all life stages, which is the name for puppies and adult dogs. It's a calcium phosphorus balance that's and some other things, but that's kind of the main one. But, I would tell you that yes, you can, that you're right. There's a misconception that puppies have to eat kibble. And then they can go to something else. You can balance a whole food diet for a puppy. It's either with a nutritionist, a veterinarian involved, or using a pre-made diet that is specified to be okay for puppies. So it's not, you can make it complicated or you can make it easy.
Mm-hmm. And in your clinic, what do you think the biggest misconception is about fresh food feeding? Is there something that stands out to you?
My dog never gets table scraps. And it breaks my heart because I was taught the exact same thing many years growing up and then in vet school and being trained and through my internship. And that's what we were taught, and I believed it because that was all it was taught. It wasn't until I became trained in traditional Chinese medicine and realized you could feed dogs food, and there's, honestly, and in the US, they're just now starting to do some studies that show that dogs and cats can eat food. Like that's where we're at. It's a very, so it's heartening to know that there's not an alternative, but another approach, right? So traditional Chinese medicine understands things in a different way, and food therapy is a discipline. There's textbooks, there's a real body of evidence for this. So it allows veterinarians who are trained in it and also pet parents who are interested in it to be able to understand food from a different perspective. Because honestly, if we're waiting for, the big kibble companies to tell us, we're going to be waiting a long time. So they can eat food, but you're right. But the puppy should not, just like we should not have potato chips and French fries all day long. Neither should our dog. You know what I mean? We should eat something healthy, and so should they. So I would say the best thing to do would maybe just to start somewhere easy. Scramble an egg, and share a little bit with your dog, because it's a low fat, natural natural protein. And so it's a perfect balance. We call it in Chinese medicine, we call it it's got yin and yang, right? So yolk and white. And that can be it's healthy for us. It's healthy for them.
Yeah. Yeah. And so for pet parents that are wanting to transition, should they just start adding, like you mentioned, an egg and a few ingredients, or should they go to a pre-made? Where should they start?
Depends on the dog, right? When I have clients who have a dog with a lot of issues, right? So just to jump to the hard ones, which are like, the GI history of lots of problems. Especially if they say, okay, well, I'm going to have you deliver, the Chiog diet to us. And I'll say, okay, great. If you want to start, tonight, right? This afternoon, right? The protein that you ordered. So if they ordered, because we do single proteins in our diets, because I want it to be very simple on the GI tract. And then if we have dogs who are doing great, then we can do custom orders and one of these, and that kind of stuff. But to start simply for dogs who are having issues, or they're very senior, they're very deficient, if they had problems, start with one. And maybe, so if they order the turkey diet, I would say take a little ground turkey, cook it on the stove, and just, a little bit of oil or butter, whatever you use. Obviously we don't want to make it a little, right? Just like you would try to make when you're making something healthy for yourself. And then add that, how much? A little, to the diet, and kind of slowly, that can be a way to transition them, as slowly over time, and just kind of start. But I would say start with one, whether it's an egg or maybe it's a little bit of sweet potato. The only thing I would caution is sometimes when we tend to think, let's get healthy with food from a human perspective, we think let's eat lots of vegetables, right? So we think let's carrots, celery, green beans. So, and those can be good sometimes, but they are different in our stomach. So a dog who's a sensitive dog, I wouldn't be like, let's give him a whole bunch of raw green beans, because when you eat those, it feels different, right? You're metabolizing it. It's not quite as gentle as if you had like a raw carrot is not as gentle as a cooked carrot, right? So that's kind of start with one, think of gentle. That would be kind of my principles.
And I think too, I saw something funny the other day. Someone was transitioning to a fresh food diet and they'd cooked up some sausages on the barbecue and given their dog some sausages. So we're talking about whole food, but we were not talking about just adding another.
Yeah, maybe not pepperoni. Yeah, you're right. I think it's, as close to something real as we can get. So we use ground meat just because we have lots of small mouth dogs. So a 3-pound Chihuahua needs to have a very small, so we use ground meat. But bigger dogs can have bigger, but you're right. Yeah, probably not processed meat. That kind of defeats the purpose.
So for our pet parents that are listening today, what is something they can take away from this? If you can just one thing that stands out.
Put some real food in your dog's bowl. Start with one and then, and slowly, but it's the concept that the idea of, we were trained, all of us, a generation of, they don't eat table scraps. If it's healthy food for you, it's healthy food for your dog. And starting slowly, and because I see daily the benefits of dogs who can get on real food diets and off processed food, just like us, right? We all know that processed food is pro-inflammatory. It works for all species.
And how about vets? Because I know sometimes they can be a bit hesitant towards a fresh food diet. What would you say to vets listening?
Well, I think we as, both, as a community and sort of as a discipline are starting to sort of realize that there are some alternatives probably to just processed dry bags of kibble. But you're right. How to move or where to move is more intimidating. That's why I would encourage veterinarians to get trained in some integrative medicine, right? Because food therapy is a concept that is not that foreign. It's can be something that can be brought in to every patient to their therapy. So that would be the first thing I would think about, is knowing that there is another way to approach food. We're not kind of off doing something that is antithetical to veterinary medicine. We're just using kind of an Eastern approach rather than a Western approach, and still using all the benefits of Western medicine. But when it comes to food, realizing that we probably need to look for a less inflammatory, I be honest with you, what I see a lot of when I talk to veterinarians is, we are a pretty hesitant group, so they'll usually start with their own dog. So that makes anybody feel any better. Vets almost always start with their own dog, see it, but and then they get a little more. That's just what I've seen from my veterinary friends.
Yeah, that is so great. Thank you so much. That was really interesting today to learn about therapy. And if our listeners want to find out more, is there a website they can go to?
Yeah, they can look. We have all our whole food ingredients listed on chidog.com. It's CHIDOG. We also deliver those meals across the U.S. So for anybody in the United States, we can deliver anywhere those meals. But if you're outside of the U.S. or you just want to sort of check out the idea of whole foods, and we do have lots of lists of chronic conditions that our foods benefit based on traditional Chinese medicine. And so they can kind of look at the ingredients and just kind of think about maybe using one or two of them in their dog's bowl.
Yeah, and definitely finding a holistic vet. If you're not in the US, you can find a holistic vet.
Yes, that would be, if you really want to do a whole food diet but aren't in the US, then that would be the definitely way to go, because you'll be able to find a veterinarian who supports you in that.
Yeah, that's great. Well, we'll put a link to ChiDog on our show notes so everyone can go there. It'll be nice and easy. And if you enjoyed today's episode, you can follow and subscribe and even leave a review if you found something in this interview particularly helpful. It just helps us to reach some more pet parents. And I'll join you next time for another episode of the Pet Care Report.